So the medications that are GLP agonists do have an effect on our weight loss, but they do not have a direct effect on the comorbidities such as diabetes, high cholesterol, high blood pressure, sleep apnea, polycystic ovarian syndrome, infertility. Losing weight helps ameliorate the symptoms of those obesity-related illnesses, but the medication doesn't necessarily help those comorbidities. Sleeve gastrectomy decreases the amount of food we eat and decreases hunger. And again, it's weight loss with the sleeve gastrectomy that helps cure those comorbidities that are related to obesity. The bypasses, including the traditional gastric bypass and SADI-S, are different because not only are they decreasing the amount of food we eat and decreasing the amount of calories that we absorb, but they're also decreasing the amount of sugars and the amount of fats in our food that are absorbed. So the bypasses, including SADI-S and the traditional gastric bypass, help with diabetes and help with high cholesterol right away. The most common thing with a SADI-S or a gastric bypass is immediately post-operatively, the patient stop their diabetic medication or their cholesterol medication or their blood pressure medication. With a gastric sleeve and the medication, it's usually 6 or 12 months later before that happens, because it's the weight loss that is curing those illnesses, not the surgery itself. And indeed, in some parts of the United States, gastric bypass is performed for patients who are of normal weight but have poorly controlled or brittle diabetes. So in patients who the doctors find difficulty in controlling their sugars with medications, they actually have a gastric bypass to help with their diabetes even though they don't have weight issues. So weight loss following medications or a sleeve definitely help with the comorbidities, diabetes and high blood pressure. The gastric bypasses, including SADI-S and the traditional gastric bypasses, cure diabetes as a result of their surgery rather than the weight loss.